We're going to dive right into a mailbag segment for today. I got asked a question that says, hey, Doc, what causes high blood pressure? Right? We're always battling it. We're seeing it all the time. What causes high blood pressure? Now, it's infinite, right? There's a ton of things that can cause it. There's a million things you can link to it. But I'm going to try and bring it back for you into one real simple, easy word. It's called stress. Now, I tease that stress is the cause of all disease and dysfunction. But men are the cause of all stress.
Huh?
That's how it works, brother. Unruly men cause all your problems. So we look at that and we say, well, what do you mean by men? There are mechanical things. Break it into 3 letters, the M, the E, and the N. There are mechanical things that affect your body. Accidents, trauma, slips, falls. All these things can traumatize or shock the body. And they all have been linked to increases in blood pressure. Get someone in an accident sometime, when they come in and they go into the ER and their blood pressure skyrocket high because the body's gone into some kind of a shock as a result of that mechanical trauma. There's E, which is emotional or energetic things that can affect blood pressure. So we're looking at, stress, anxiety, fear, anger, frustration. Get around someone that kind of pushes your buttons. See what your blood pressure does. Up it goes, right? You can get into...
Like every Wednesday about this time?
I'd like to think it was just a little bit before this time. But as we look at this, we think to ourselves, okay, those stresses can affect the body, right? Those emotional things can get at us. And then we get into the nutritional side, or the N in men. Now, this is what we're eating, what we're drinking, the air we breathe, or the chemicals that are in it, all the environmental stuff. It's a combination of these things. So how do you deal with it, right? What do you do when you've got a blood pressure problem? You go through and you balance the body. Guys, I have done this more times than I can count. And when you look at medications, they're fine. They're Band-Aids. They're fire trucks on fires. They never, ever, 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 did I say ever, ever fix it. Ever. Right? They'll lower it down and say, oh, my blood pressure's been normal since I'm on my 2 medications for it. All right, take the meds away and see what happens. Right back up it goes. Because it's not fixing it. Right? It's not looking for the cause. You have to hunt the cause. So if you're someone that's battling blood pressure and you're having problems with this, you've got to look for what's the reason. Well, we know what's the cause of all disease? Stress. What's the cause of all stress? Men. What in your men world is out of balance? And that's really what you're looking for. Where is it out of balance? What things are kicking off inflammation? What things are causing problems? So here's a few things, when the inflammation kicks in and stress gets you going, dehydration is probably the easiest thing you can do to affect blood pressure. Just go through and look at that and say, okay, blood, it's protein and water, for a lack of, better wording. Water, okay, I get that. Protein, it's like mud. It's like dirt. When you mix these 2 things together, the more water you put to it, the thinner it gets. The thinner it gets, the easier it goes to the plumbing. The drier it gets, the more mud-like clumpy it gets, the harder it is to go through the plumbing. The pump on the other end then has to work way harder to make that happen. If you get the body real tight and nervous and anxious and you go in what they call fight or flight syndrome, right? Sympathetic dominance, everything tightens, arteries included. And all of a sudden now you can't pump through those tight, brittle pipes, and they rupture and they break. Blood sugar has been directly linked to it. So what could we do? We could clean up our diet, improve our blood sugar a little bit, add water, and just see what happens. Give it a month. See what happens. If it doesn't get it, then you're going to have to dig a little deeper. You have to look for more causes. But here's one I wanted to bring up because I thought this would be fun for you guys. One study that was out there proved it. Mouthwash increases blood pressure risk. Now,
really?
Who knew, right?
Yeah.
And it's because of the chemicals that are used in the mouthwash. Those sanitizing agents that they put in mouthwashes. Repeated mouthwash use has been directly linked to an increase in blood pressure. So if I'm sitting around and I'm going, man, my blood pressure's been up lately for no reason, and I'm using mouthwash 2 and 3 times a day, stop. Just stop for a month. See what happens. If it drops, you found your answer. All right, guys, I'm Dr. Sean. I'll be back in just a moment.